According to the American Red Cross Association, survival chances decrease by 10% for every minute that immediate CPR and the use of an AED are delayed. CPR can increase the chances of survival, but someone can collapse at any moment, so it's important to know the basics. I was first CPR certified at the age of 11, and I'm required to know the basics as a swim instructor as well. So today, I'm going to be using Andy today as my demonstration to show you the process of using CPR. I use him a lot as I teach kids about this process as well. So the first thing you are going to do is make sure that the scene is safe. You don't really know why he collapsed unless you saw it in the moment. So you want to make sure you watch for anything that could hurt you. So this is some sharp objects. Watch for needles, any uses of drugs. Watch for any sharp objects such as glass, anything that may have injured this victim. So you want to watch for that before you approach it, okay? So that is step number one. Once you have made sure that the scene is safe, step two is to see if he is all right. You're going to see if he is responsive. So I'm going to tap him and I'm going to shout at him. Are you okay? Are you okay? And if they do not respond, most likely something is wrong. You can also check for breathing. I always recommend checking for breathing over a heart rate. For one, it is a lot easier to check for breathing. You can look at their chest to see if it rises or if it falls. If it does not, usually means they're not breathing, whereas checking for a pulse is usually a little bit trickier to know for sure. Also, if the reason why they collapsed was from lack of breathing or if they were choking, sometimes they will still have a heart rate, they are just not breathing. In that circumstance, you will still want to apply CPR because at some point their heart is going to fail them without breathing. So one is important to check for breathing. Once you have seen that he is truly in trouble, the next thing is you got to make sure you call 911 as soon as possible. Now, I recommend telling someone else to call 911, but be careful not to just shout it out and say, anyone call 911. It is better to pick out a specific person, point to them, and say, you call 911. In the emergency situations, people will panic and not know what to do, so it is good to give clear instructions to people. If you are alone in this situation, it is best to call 911 yourself. Put them on speaker mode so that you can help assist him while on the phone. You're also going to ask to see if there's an AED around, see if someone can find one. If you are alone, it's better to try to assist this person than try to find an AED. The next thing you're going to do is start the process of CPR. So what you're going to do is come up to your victim. You're going to want to be a little bit higher on your knees so that you have a lot of leverage to push on their chest. You're going to have your hands on top of each other on the center of their chest. Keep your elbows locked, and you're going to try to push in about 2 inches deep as you press. Roughly, you will want to press, do 100 to 120 compressions per minute. This is about the speed of Baby Shark or the old classic Staying Alive, so that can help you out as well. More than likely, as you are pressing, you may break something or hurt their chest, and that is okay because we do want to press hard enough that we are pushing on their heart to be able to send blood to the brain. That is why we have the Good Samaritan law that keeps people like us who are performing CPR from being liable of any damages or if this person still ends up passing away. So you are going to do CPR as long as possible while the ambulance is on their way to help. If the 911 instructor tells you to do anything else, you're going to listen, but for the most part, you are going to be doing CPR the whole time. Sometimes they do tell you to give breaths. That is fine, but it is typically more helpful to do CPR over giving breaths. CPR is what's helping get the blood from his heart up into his brain. Breathing is nice to get air, but when you stop the process of CPR, you are stopping blood from getting to their brain. So more than likely, it is going to be helpful to continue CPR over giving breaths. If an AED is available, it has instructions on the pads on how to use it. It'll show you where to put one on the chest, one down here as well. If the victim is a child, however, the one will go on the chest and one will go on the back. It is important to make sure that all top clothing is completely removed. The AED will give instructions about when to give a shock if necessary. It is very helpful to have an AED in these cases because it can also check for a heartbeat, and it will also advise you to give a shock if needed. If it is not needed, it may just require you to give CPR. So you're just going to continue to do that until help arrives. So in conclusion, these steps are to be practiced because in emergency situations, more than likely, we are going to panic and not know what to do. So you want repetition to get yourself very familiar with the process so that you don't panic. It is very important to stay calm in these situations. So I recommend always going through some sort of training, watching some videos, at least to know the basics.